A sprained muscle is a common injury in sports, but some might even experience the injury while riding their bike to work. For professional sportsmen, it is critical for their careers to overcome the injury quickly. For common people, a strained muscle injury can mean that you're not able to do common tasks in their everyday life, such as grocery shopping. Therefore, it is an impediment for people if they don't overcome the injury quickly. There exist technologies that helps people rehabilitate from the injury. An example is Wii Fitboard, where one can do different exercises that help the rehabilitation of an injury. But a specific technological help to treatment of a strained muscle is not yet available. A strained calf muscle is treated by a method called R.I.C.E. R.I.C.E consists of the four principles: rest, ice, compression, and elevation. From here, the final problem statement was formed. How can we help physiotherapists carry out an optimal treatment of a strained calf muscle with the principles of R.I.C.E using sensors technology? To create a prototype which can live up to what the R.I.C.E principle requires, interaction design was taken into consideration when implementing the product. Most importantly, the requirements are the foundation of the product. The R.I.C.E principle is divided into 4 sections: rest, ice, compression, and elevation, which each was given requirements. The product should be able to let the patient 1. See if they are resting and are lying on their back, also to check how much they move. 2. To cool the strained muscle without letting the patient's skin touch the ice, also to let the ice be on the injury for 20 minutes with 2 hours gap, and also let them know when to change the ice. 3. To have enough compression on the injury. 4. To let the leg be elevated above the heart level. And 5. Let them be able to see if they are carrying out every principle correctly. For the physiotherapists, an application has been designed to show their patients progress during the first 24 hours that the R.I.C.E principle extends. While designing the prototype, each principle was given a sensor that could fit the given requirements. For the rest principle, an accelerometer was implemented within the band. For the ice principle, a thermometer was placed inside a pocket within the bandage where the cooling element is placed. The compression is designed to be a bandage with a pressure sensor implemented. For the elevation part, a tilt sensor was used. The program, which has a connection to the product, is specially designed for the physiotherapists to check on the patient's progress. The program shows graphs for each R.I.C.E principles, so the therapists can check if the patient has followed the principles correctly. To test the usability of the product, there was made a group interview with 3 physiotherapists. They both saw the product in use and also the additional application, which was carried out by 2 group members. The physiotherapists discussed with the group members and among themselves about the product, and the principal results of the interview were: the R.I.C.E bandage followed all principles, which means the group had fulfilled the final problem formulation.